Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be talking about vasculitis, a rare but serious group of diseases where the blood vessels become inflamed. And because vessels are the body's highway for carrying blood, when they're damaged, organs, tissues, and much more can suffer. But with the right diagnosis and treatment, many patients can live full and active lives. To help us understand what it is and what these groups of diseases are, why it happens, and how it can be treated, I'm joined by my colleague, Dr. Bryn Henderson, a board-certified physician and leader in regenerative medicine. Dr. Henderson, thank you for being here today.
Well, thank you for having me. It's a privilege.
So let's talk about vasculitis.
Vasculitis is when the body's immune system, so it's an immune disorder, mistakenly attacks blood vessels, just like Helen said, and it causes inflammation. This makes the blood vessels' walls thicker and weaker, which can narrow and block blood flow. If severe, it can even rupture a vessel. The type of vasculitis depends upon the size of the blood vessel. It can be large, medium, or small.
Let's talk about the different types then.
Doctors often group them into three categories. Large vessels, for example, giant cell arteritis, affecting the big arteries like the aorta. Medium vessels, like Kawasaki's disease or polyarteritis nodosa, targeting the vessels that supply organs. And the small vessel vasculitis, such as polyangiitis, damages tiny capillaries and arterioles.
All right. So what triggers vasculitis?
The exact cause isn't always known, but sometimes it's linked to autoimmune disorders like lupus and rheumatoid arthritis. It can also follow infections, certain medications, and even cancers of blood. Genes and environmental factors both play a role.
All right, you mentioned genes. Let's talk about that.
Well, some genetic patterns make people a lot more likely to develop autoimmune disorders like vasculitis. And in most cases, these are not inherited directly. They're sporadic.
So if we go over to traditional Chinese medicine, how do they view vasculitis?
Vasculitis are often seen as problems with blocked flow. Qi and blood are those that are blocked. So acupuncture and herbal treatments are often used to improve circulation, calming the inflammation, and balancing the immune system. Big deal. Some small studies suggest these approaches support recovery when used alongside the standard medications.
Well, how do you, in your office, diagnose vasculitis?
Well, it depends upon the type. Again, all you really have to do is start with the size of the vessel. But blood tests can show signs of inflammation pretty quickly. Imaging, like CAT scans and MRIs, angiography, those are the dye tests of the vessels that shows when they're narrowed or inflamed. Sometimes a biopsy of the affected tissue is needed to confirm the diagnosis.
All right. You mentioned that you can see on a blood test. A lot of our patients can go into a portal and they look at their lab before, say, I even have looked at it. So I would like to let the patient know what is the lab that shows the inflammation.
Two major ones was the sedimentation rate is one, and the other one is the C-reactive protein. Both of those usually are in tandem in terms of if they're elevated. And there's labs give you the normal values, but those, remember, depend upon the lab. Each lab may have a little different one.
Okay. What does it look like on a CT? You mentioned imaging, and you mentioned MRI. What is the doctor looking at?
What they see there is the vessels themselves. Now, remember, they have dye in them, so they can see if the vessels are narrowed, and they can see if they're inflamed. Either one of those are a very big hint of vasculitis.
So, what is standard of care treatment in the United States of America today?
Today, you have to address the medication to calm the immune system. Remember, we started out by saying it's an immune disorder. So the number one, or the strongest for sure, is corticosteroids. They're often the first line, and especially in severe cases, they immediately calm it down. The immune suppressing drugs like cyclophosphamide or methotrexate can also be used, but a simple, straightforward corticosteroid is often the initial treatment because it can be tailored to the type of vessel, the severity, and help protect organs.
All right. You're saying immune suppressing drugs like cyclophosphamide or methotrexate. I thought you said it was an immune disease. Why do you want to suppress the immune system?
That's a very good question, and it's very easy to understand because remember, the immune system is a balance. So what you're doing is you're enhancing the depressed portion of the immune system that allows the body to get back into a balance. Very similar to like the traditional Chinese does. It is very focused on balance, and we're getting there. We're learning from them.
All right. So let's talk about the new therapies that you have and have had in your office for many, many years as one of the forefront physicians, board certified physicians in regenerative medicine.
Yeah, the early research was fun because it's exploring regenerative cells to reset the immune system. So instead of a medication, we can insert cells that make new cells. The biological therapies that are more precisely targeting inflammation are also very available, and although not mainstream, represent areas of development without a doubt.
So I'm thinking, I'm reading people's minds right now who say, I don't want to take any medication. I'd rather have something natural to help me. So you're saying if a person is afraid of methotrexate or they're afraid of these other medications, they can come in and have something natural done to help the inflammation.
Absolutely.
All right. So let's talk about lifestyle changes.
Lifestyle is very important. As in most illnesses, we begin with nutrition. An anti-inflammatory diet that's rich in fruits, vegetables, and lean protein is how we begin usually utilizing omega-3s. Exercise becomes the next arm. We're not trying to make you strong. We want to make sure everything works. So regular activity improves circulation without straining. And then the stress management is irregular because it helps us all if we can decrease our stress, because that decreases our inflammation. Mindfulness and yoga practices are extremely beneficial there. Regular monitoring for early recognition of flares is key to preventing organ damage.
All right, so a person has been diagnosed with vasculitis. What's their long-term outlook?
Well, it varies with early treatment and the size of the vessel, we already learned, but many patients go into remission. Though relapses are possible, they can be controlled. What you want to do is you want to eliminate the long-term organ damage, especially to the kidneys and heart. So the good news is these modern therapies have greatly improved survival and the quality of life.
Well, what's your mnemonic for vasculitis care?
Oh, this is an easy one. It's vessel.
V?
Vigilant monitoring for flares.
E?
E is for early treatment with steroids or immunotherapy.
S?
Is supportive lifestyle, diet, exercise, and stress.
S?
Another S for specialists, rheumatologists, nephrologists, cardiologists.
E?
Education for patients and families.
And L?
Long-term follow-up to protect organs and to monitor.
Well, thank you, Dr. Henderson, for taking us through vasculitis, a group of conditions that may be rare, but with awareness and treatment can be managed successfully. If you or someone you know experiences unexplained fevers, weight loss, symptoms affecting multiple organs, it's important to seek medical advice early. So, thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.